Hi, this is Nash Jocic, and I'm going to talk to you now about the importance of low-carb diet for maintaining good health. As I have pointed out many times in my books, in my DVDs, in my videos, in my articles, low-carb diets are very effective when it comes to fat loss. They're not only the diets that will stop you gaining more body fat, but also low-carb diet will force the body to start using its own fat stores and rely on them as the main source of energy. But apart from being the most effective when it comes to fat loss, low-carb diets are also very effective when it comes to prevention of many deadly diseases. Today I'm going to talk about prevention and eventually cure of something called metabolic syndrome. So, what is metabolic syndrome? Metabolic syndrome is the collection of at least 3 health consequences. There are 5 health consequences that count. Number 1 is hypertension, high blood pressure. Number 2 is increase in abdominal fat. Number 3, high blood sugar level. Number 4, high cholesterol. And number 5, high triglyceride level in the blood. So if you have 3 of those symptoms, you will be diagnosed with metabolic syndrome. Metabolic syndrome dramatically increases risk of developing diabetes 2 and heart disease. So it's something that everybody should stay away from. An underlying cause of all these 5 symptoms that I have mentioned is insulin resistance. So how do we get insulin resistance? Well, the diet that is rich with carbohydrates, diet in which you eat carbohydrates 4, 5, 6 times per day, will generate production of high level of blood sugar throughout the day. High levels of blood sugar will obviously need to be metabolized, and the only way for that to happen is for the body to produce adequate amount of insulin. So more blood sugar you produce, more insulin has to be produced in order for the blood sugar to be stored in muscles as glycogen, is in liver as liver glycogen, and also in body fat cells. So if the body is flooded with insulin, if you're producing insulin all the time, muscle cells will be bombarded with insulin all the time, and they will start resisting insulin, or they will start responding to insulin. That means that insulin wouldn't be able to deliver sugar to the muscle cells. Once we develop that problem of insulin resistance, insulin will turn back all this sugar into the bloodstream. The body will respond to that by producing even more insulin in order to solve the problem. But the problem will be hard to solve simply because the body will react constantly with resisting insulin. And this is exactly what is causing insulin resistance: overconsumption of carbohydrates and overproduction of insulin. So now, what happens when we develop insulin resistance? Well, number 1, we develop hypertension. So insulin resistance causing hypertension. First of all, too much insulin directly affects the soft muscle tissue of the arteries, which in response start thickening, becoming more rigid, and increasing blood pressure. Also, increased amount of insulin due to insulin resistance increases LDL, which is bad cholesterol, and that LDL accumulates on the arteries much easier, again causing blood pressure to rise. So now the second reason, increased abdominal fat. Is known that increased insulin production causes dramatic increase in abdominal fat. Because muscle tissue is not willing to accept blood sugar and store as glycogen, fat cells becoming much more friendly now towards insulin, and insulin starts transporting much more sugar to fat cells, especially in the abdominal region. And this is why insulin resistance through higher production of insulin causes increase in abdominal fat. Problem number 3, increased blood sugar level. Since insulin can't deliver successfully sugar into the muscle tissue, sugar is returned back into the bloodstream, increasing the sugar levels. Cholesterol, number 4, insulin, hyperproduction of insulin causes increase in LDL, which is low density lipoprotein, known as bad cholesterol, and in the same time lower production of HDL, which is high density lipoprotein, known as good protein. In overall, cholesterol rises, and this is how we develop unwanted consequence number 4. Number 5, increased level of triglycerides in the blood, directly linked to hyperproduction of insulin. So all these symptoms are actually caused by hyperproduction of insulin. And if you have 3 of those symptoms, then you will be, as I said, diagnosed with metabolic syndrome, and your risk of developing heart disease and diabetes 2 will be very much increased. So how do we prevent now metabolic syndrome, and how do we prevent insulin resistance and all these symptoms? Simply by following the healthy diet, which is predominantly made of protein, with moderate amount of essential fats, a low amount of carbohydrates, high amount of fiber, and high level of water as well.